Tuberculosis, a scourge some 40 years ago. In 1948 alone, over 1,600 people died from tuberculosis. The Public Health Service had the burden of controlling this disease. It was a dreaded disease which many feared. Even until today, this fear remains.
I was depressed when I found I had TB, because this sickness is, many people are scared of this sort of sickness because it can spread. And I also have a family with me, so I was worried. I do not know how they're going to accept me in the family because I have this sickness.
Makcik perasaan macam rasa kecewa lah, macam rasa makcik ni macam tak ada harapan nak hidup lama lagi kan. Maksudnya kita dah sakit kan. Jadi makcik rasa takut, dia macam gitulah.
Many of the patients who came for treatment at Tan Tock Seng Hospital were patients who had very advanced or fairly advanced disease, and they had symptoms of cough, coughing out blood, of losing weight, and being really in poor health.
Living in housing conditions then were poor, overcrowded and unhygienic. This was conducive to the spread of TB. It was estimated that 1 out of 20 persons living in the city had TB. In order to arrest the disease, early detection was crucial. Thus began Singapore's battle against TB. A mass X-ray campaign was launched on the 1st of July 1958. It was a pioneer survey aimed at discovering the spread of TB in both urban and rural areas. 4 districts were selected: Chinatown, Jalan Sultan, Geylang and Bukit Panjang. Residents above the age of 14 were surveyed. The medical staff went to the community centers and schools to conduct the X-ray exercise. In order to encourage the working population to turn up for the exercise, X-ray hours were extended to 10 in the evening. For many, being X-rayed was a new experience.
Whenever we went to the area where we would do the X-rays, the people used to crowd round our vans. They were very inquisitive and curious to know what was happening. It was a novelty for them at the time. The response from the people was not very satisfactory because some of them were afraid of radiation. And also there were ladies who were very shy. They thought they had to remove their clothes. We had to convince them that it was not necessary to remove their clothes, and also the radiation given was very negligible.
Nurses had to go from house to house encouraging people to come for the X-ray screenings. And vans with loudspeakers also went out on the roads to publicize the campaign. Despite the publicity given, people were still reluctant to be X-rayed. TB then was a disease much feared. Staff nurse Roberto recalls the stigma attached to the disease.
Usually, patients do not want their relatives and friends to know about their disease because they might be shunned. And employers, if they should come to know of the illness, they might lose a job. And fear of the long-term treatment, which requires hospitalization and in hospitalization and loss of employment.
The 1958 campaign lasted 4 months, and by then, some 51,000 people were x-rayed. It had a positive effect. It was discovered that about 2,000 people were infected with TB and needed treatment. At that time, Tan Tock Seng was the main hospital for treating TB. The control unit also monitored new cases that were being discovered. After the 1958 campaign, the fight against TB continued relentlessly with the help of mobile X-ray vans. Voluntary organizations such as SATA carried out joint surveys with the government. This allowed a greater percentage of the population to be surveyed. Community leaders also lent support by participating in the exercise. To drive the message further home, anti-TB exhibitions were held. This was not only to allay the fears of the people, but also to educate the public on the necessity of X-ray screenings. Another major step undertaken was the introduction of the vaccine BCG. BCG vaccination was made compulsory for newborn infants as well as school children. These vaccinations helped to protect and immunize the young against TB. All these measures helped to control the spread of TB. With early detection and use of new effective medicine, the fearful disease was cut down to size. The number of deaths fell from 1,680 in 1948 to 168 in 1985. But with TB under control, there were still other health problems to overcome. Under the new government in 1959, steps were taken to establish a coordinated public health service. A crucial feature was to bring medical services to the people. Nurses and midwives began visiting homes, giving treatment and immunization injections to children, as well as advice on childcare. At the same time, maternal and childcare clinics were set up. This was where mothers could go to have their babies examined. To solve the problem of overcrowding in hospitals, separate outpatient clinics were built in various districts to treat the patients. Even today, this concept of bringing medical services to the people prevails. With most of the population living in flats, polyclinics were introduced. These clinics provide a combination of services, outpatient treatment for general illness, as well as maternal and childcare. At present, there are 12 such clinics located at various housing estates. Our health service has come a long way in providing medical care for Singaporeans. Today, it is meeting new demands and challenges.
Now with the control of tuberculosis and other infectious diseases, we can now focus our attention on the killers of today, namely cancers, heart disease and strokes, and also in the development and strengthening of our subspecialties.
The medical service is now heading towards specialization in areas such as cardiothoracic surgery and neurology. Research, especially in the treatment of cancers, is given paramount importance. With the availability of modern technology and the expertise of the medical staff, the aim of the medical service is to provide better and efficient healthcare for all Singaporeans.